My name is Ruchir Puri and I'm a foregut surgeon at University of Florida in Jacksonville. I'm very happy to share the story of one of our patients, Ms. Sandra Pompey. Ms. Pompey has had severe GERD and acid reflux for more than 2 decades.
Hi, I'm Sandy Pompey. I am 62 years old and I am currently retired, but I was a veterinary technician for most of my life. I've traveled the world doing animal rescue projects, and the only thing that was really kind of in the way of all my travels and things was the fact that the GERD would stop me sometimes from living my life the way I wanted to, eating what I wanted to eat, or having to always be prepared with all the meds and things that I would have to take to keep that under control.
So GERD is gastroesophageal reflux disease, and it's commonly mistaken for acid reflux, and it's not the same thing. So the difference is acid reflux is something that happens to any one of us once in a blue moon. So we go out, we eat like say heavy spicy meal, and maybe get heartburn at night. That's acid reflux. GERD, or gastroesophageal reflux disease, is that symptom of regurgitation, meaning acid coming up in your throat, or heartburn that happens frequently. And generally, if it happens more than twice a week, we call it GERD.
I was to the point where I was basically living on smoothies because everything else would give me heartburn. I was just tired of it. I knew every time I would like plan a trip somewhere, I'd have to remember, oh, I need so many bottles of Tums, and I have to make sure I don't eat the wrong thing. And so I was really ready for something to happen.
And she's been suffering to a point where she's completely incapacitated by her symptoms, inability to eat, drink, and reflux all the time. She underwent an acid-reducing operation called a laparoscopic hiatal hernia repair and a partial fundoplication. And like most of the patients who had this operation, she had the operation and immediately from next day reported relief of symptoms.
The pain stopped immediately. I can't even begin to tell you. It was just like day and night. The day before, I was still having to take the medicine. I did the surgery, I woke up, and I'm like, oh, this is great. And so that was remarkable. And Dr. Puri said that that's what would happen, and I thought, oh yeah, sure. But it really did. It was just immediately. My experience with UF Health was great because of the people. I obviously feel that they're knowledgeable in what they do. They've got years and years of experience behind them, but the people themselves care about their patients, and they know what they're doing. They have so many specialists. I've had issues other than the GERD that I've had, that I've dealt with UF Health, and in every instance I've felt so comfortable because the people there care about you as an individual. You're not just another patient.
I think the biggest thing that that makes us different is, in Jacksonville at least, that we have 3 foregut surgery trained surgeons at UF Jacksonville. No other center in town can claim to have 3 surgeons who do just this, and that is foregut surgery. So I think it's not just about the surgeon doing the operation, but the team of gastroenterologists, nurses is stellar across the board.
So really what I have to say for anybody who's kind of on the fence about doing this surgery or not doing this surgery, if you've suffered like I have, I would not hesitate to go through with it. It's just, it will change your life. I would do it over again. I wish I would have done it 20 years ago, so I wouldn't have had to gone through all the problems that I've had to encounter. But it's just been a godsend. Thank you.
So if you're the person who's had long-standing GERD, who has been on medications, and they are just not doing enough, and you're still suffering despite being on medications, then you should come and see us. At least get an insight as to what we have to offer. And if that does not work for you, you can always keep taking the medications, but at least come and know your options that exist to make you better.